So hello, everyone. I'll just wait 1 minute so that everyone is able to join the room. I see that you are all joining now, and then we can start. Okay, so I would slowly start, if it's okay, also for my panelists.
Yes.
Okay, perfect. Thank you so much. So, hello everyone and welcome. Good morning, good afternoon, good evening from wherever you are. Welcome to the first session of our G2H2 policy debates ahead of the 78th World Health Assembly. My name is Alessandra. I am the Executive Secretary of G2H2, the Geneva Global Health Hub, and these webinars that we are co-organizing with our network members are a space for everyone to get to know better what our members are doing, what are the activities, what are their focus and areas of work. But before moving into the actual policy debates, I would really like to spend 30 seconds explaining to you what is G2H2, because I'm sure that not all of you are familiar with it. G2H2, which is the short version of the Geneva Global Health Hub, is a network of civil society organizations, which was built in 2016 with the aim to provide a safe space in Geneva for civil society organizations that are engaged with global health and that are coming from all over the world. Since 2016, these organizations, they meet, they share knowledge, insight, information, and they also engage in common projects and activities and advocacy. If you already know what G2H2 is and you like our activities, I kindly suggest you to be in contact with me, with us, and to join the network. If you don't know what G2H2 is, but you would like to have more information, please write to me as well. And I will be very happy to guide you through what G2H2 is, what are our activities, and how you can engage with us. But let's move now to the G2H2 policy debates that are happening this week. We will start today with this session, which is co-hosted by Dianova, on which this very interesting title, Growing Up Safe Public Health Approaches to Drug Use Prevention and Treatment in Childhood and Adolescence. We will keep on Wednesday focusing on something that it's not drug, but it's always related to the topics of addictions, but we will look at addiction through the lenses of nicotine, tobacco, and ultra-processed food. And then on Friday, we will have a last meeting on the pandemic accord. Before giving the word to Gisela to actually start the meeting, I would really love to give you a few housekeeping rules, which are, the session is in English, there is no translation. The session is recorded, which means that starting from this evening, tomorrow morning, if you take a trip into the G2H2 web page, I will share the link with you afterwards. You can find the recording of the session. And then if you want to engage in the discussion, if you want to ask questions, you have a Q&A box that you could use for asking questions and engage in the discussion. And without further ado, I would really like now to give the word to Gisela and her wonderful panel. So thank you so much, and I'll see you later.
Thank you very much, Alessandra. Good afternoon, evening, or good night, everyone, depending on where are you located. It is a true honor to welcome you all to Growing Up Safe, a special event co-hosted by Dianova International and G2H2, as Alessandra already explained. So taking place just before the 7th World Health Assembly. My name is Gisela Hansen, and I serve as Institutional Relation Coordinator at Dianova International, a Swiss public interest NGO composed by 20 nonprofit organizations operating in 70 countries across 4 continents. Through the fieldwork of our network and our advocacy effort at international institutions, we contribute to achieving the Sustainable Development Goals, focusing especially on health and drug policy, social inclusion, and human rights. To date, events focus on the role in public health approaches in preventing and addressing drug use among children and adolescents. Together with an exceptional lineup of speakers from the WHO, UNODC, and civil society, we will try to examine disconnects between drug and health policies, promote science and right-based models, and share on-the-ground experiences from diverse and often underrepresented regions. We sincerely want to thank to the G2H2 network for offering this platform that connects governments, institutions, and civil society in dialogue, these amazing speakers line up and our committed audience. So as Alessandra already explained, please remember that you can submit questions in the Q&A box, and if time permits, the speakers will respond. This session is being recorded and will be made available afterwards. And well, now, without further ado, allow me to introduce our first speaker, who will deliver the opening presentation for this important conversation on addiction prevention, children's rights, and health. It is truly a privilege to open today's event with Ms. Anja Busse, head of the Alcohol, Drugs, and Addictive Behaviors Unit at the World Health Organization. Anja has been a global leader in the field since 2005, driving evidence-based strategies for drug dependence treatment and care. We deeply thank you, Anja, for being with us today. Your presence and insights are invaluable to this discussion. Thank you very much. Over to you.
Thank you so much for having us. It's really a privilege to be here at these G2H2, I think, right, talks, and to bring the topic of substance use prevention and treatment, especially for adolescents, also closer to the discussions as the World Health Assembly is approaching. So let me start sharing my screen, which we tried before and it seemed to work well. So I hope also now it's going to work well, but you let me know. Are you seeing the slides and hopefully in presentation mode? Yes, okay.
No, we are seeing the notes.
That's what I was afraid, because it looked different to before. Let me try once again.
Okay.
So I think this one should work. Now it came back. This looks better, like?
No, that is perfect, Anja. Yes.
Okay, great. So after the thanks really for having us, let me just give you a few updates from us here at the World Health Organization to get into the topic. And maybe just to say that I have prepared this really like a bit of an overview, and I'll touch upon a lot of topics, but you will also see resources on the slides where at any time you can go and do a bit of a deeper dive than what we maybe can do today, right? So now, yeah, just for those who don't know, obviously as a World Health Organization, we are a specialized agency of the UN system around promoting health, keeping the world safe, and serving especially the vulnerable. And when you look at the constitution of the World Health Organization, which is from 1946, you see that among kind of these other very familiar statements around health being a state of complete physical, mental, and social well-being, and so on, there is also in the constitution this notion on the importance of healthy development of children. So I just wanted to highlight that. And as we're speaking here, I thought the title was really interesting, that you focused on the public health response to substance use prevention and treatment. And I think, just good to remind us of basic public health principles, that really would mean that we need to think how we can reach the highest number of people with the most effective and at the same time, ideally least costly and least invasive strategies or intervention. And that growing up in a safe environment really would mean that we want to create an environment in which it's easy for people, including children and adolescents, to not consume alcohol, tobacco, or drugs. So, I mean, the burden should be in a way on the system, on all of us, and not on the individuals, right, so much. And at the same time that we should create an environment in which it's as feasible as possible for those that have initiated substance use to stop, reduce, or be prevented from further harm. So that's just a reflection on this public health thought. And you mentioned already, Gisela, the importance of the Sustainable Development Goals, right? And I think especially the Goal 3 really again speaks kind of to this creation of enabling environments, as it says, ensuring healthy lives and promote well-being for all at all ages, right? So it clearly speaks kind of here to the topic of our webinar today. And you all remember that there is this target under the Goal 3 around strengthening prevention and treatment of substance use. And just to put in perspective, so I know we here focus maybe more on drug use, but just to look kind of at the epidemiological data around the estimated number of people across all ages, right, using psychoactive substances, with a vast majority, around 2.5 billion people, using alcohol, followed by tobacco, and then around 0.3 billion people using internationally controlled substances or drugs. And this is also kind of a slide on substance use among those 15 to 19, so those that fall into the adolescent bracket. And it's estimated at global level that around 22% are using drinking alcohol, but there are vast regional differences from 1.1% to 44%, which again speaks to the fact, right, that there is an influence and that environments and do play a role kind of in this. And UNODC has provided data around, this is cannabis use for those 15 to 16, which in 2021, there was a prevalence estimated of around 5.3 percent. But what you can see is that in most of the regions, the cannabis use is higher among this young age group than in the general population over more age groups. So I'll just do a little bit of a dive into substance use prevention. And you see the WHO, UNODC jointly produced international standards on drug use prevention, but I'll also kind of have taken information from these additional publications that have been prepared together with also other UN agencies. And, and as we are here talking public health, I think it's good to think of the different settings or strategies in which drug use prevention can take place, from the population-based strategies then to various, let's say, organizational settings and to individual kind of interventions. And maybe a few kind of things to get us on the way. So, in line with this public health principle I mentioned at the beginning, population-wide prevention would have the highest reach, but we still need to keep in mind that those need to be evidence-based and also consider interventions for higher risk groups in there. Another kind of principle would be the earlier the better, right? But that it's never too late to plan for effective prevention. And then as additional, to have a focus on development and structural interventions beyond kind of sharing information or only targeting individuals. Then that ideally we can target multiple vulnerabilities and work across many levels with one intervention, which also kind of in situations obviously of limited resources makes a lot of sense. And as always, to have proper planning, involve multiple and relevant stakeholders to really envisage substance use prevention systems at national level. So here I will go rather fast, right? Just to mention around population-wide strategies. So those can include either restricting or regulating the availability, distribution, production, and so on of psychoactive drugs. And there's a lot of experience more also on the alcohol side, right? And that we need well-functioning health and social care systems around in an environment where we want to implement effective drug use prevention. And I just put here, again, I'm sneaking in the alcohol, our safer intervention, which is around making or creating a world free from alcohol-related harms. And among the 5 kind of high impact interventions that the SAFER initiative is promoting, you see that 4 of them are actually population-based interventions like restrictions on alcohol availability or raising alcohol prices, right? So the emphasis on these is really on population-based strategies. And then when we come into the organizational level, right? So there are, for example, schools, a good environment where to work on substance use prevention. And there are some things like retaining children in school that in itself have proven very effective, than to have kind of comprehensive school policies around. So for example, having kind of no substance use in schools, but also very transparent mechanisms should this occur. And then programs that are based on social competence that can be included in school programming. So health systems, I have hinted to before, would be another area where we can intervene. And that includes, for example, beyond the fact that we just need to have health systems that are working and effective and accessible in place. For example, where screening and brief intervention, including for adolescents, can be implemented well. Workplace settings are often discussed, and even adolescents, right? So that goes up to 19 would find themselves in the workplace. And there is evidence, especially around improving mental health at the workplace, but the evidence, especially around substance use or specific outcomes for substance use, is still weak at this moment, and is something that would need to be strengthened beyond kind of obviously knowing that when we promote our mental health, right, that can have a beneficial outcome on reducing the likelihood for substance use. So community is another kind of setting in which effective prevention can take place, for example, through multi-component initiatives, again, agreements on substance use-free environments, and mentoring at the community level, where kind of children and adolescents that are non-related come together and spend meaningful time can be among the community-based preventions that have been recommended. Family-based prevention has a lot of evidence also behind, and I'm sure Wadih will speak a lot of this. And it's really something where we can think of the life course from very early kind of beginnings, where we work with pregnant women, or then prenatal and infancy visits, through parenting skills programs for various age groups, and early childhood education. And then individual-based prevention, there are also kind of a number of programs and interventions available. Maybe here I take out really the importance of addressing mental health conditions early on, as that, so to say, is effective or can be effective in preventing also substance use in later life. So for example, addressing attention deficit disorder or so, which has been linked often with substance use in later life. So maybe just to say that there are also a few maybe often used or popular areas, but with questionable or no evidence, and that's, for example, media campaigns, something really to be looked at very carefully. In general, kind of the evidence is weak. There might be some ways kind of how they can be implemented as part of more comprehensive strategies. But other things that I also don't have proven evidence would be, for example, just giving information or just giving lectures or sports as such and so on. So all of this may be kind of combined with other interventions, but in general to think that well-meant interventions are not necessarily evidence-based and effective, and where we should put, so to say, the scarcely available public health money. Just wanted to kind of highlight also 2 additional publications. One are these guidelines on mental health, promotive and preventive interventions for adolescents, maybe also with the thought that when we speak substance use, right, or drug use prevention, it's good to also think alcohol, tobacco, and so on, and think a bit broader, for example, in the mental health setting, or then I will say also in adolescent health in general. So from these guidelines, there are a number of recommendations that have been made through a very strict guideline process. And 3 of the 5 recommendations that were made there also had points around substance use. So for example, that universally delivered psychosocial interventions should be provided for all adolescents, and that also has shown positive effects around substance use. The other is how psychosocial interventions should be provided for adolescents affected by humanitarian emergencies. And there is also kind of a maybe slightly weaker recommendation, but still, this is really an area where all of our efforts are growing, that also should be considered around reducing substance use in populations affected by humanitarian emergencies. And then kind of maybe a bit more of a conditional recommendation, how indicated psychosocial interventions should be provided for adolescents with disruptive or oppositional behaviors, but especially with caution around those with substance use issues. One of the things you see here, that while the strength of recommendation can be strong, the certainty of evidence is rather on the lower side. So that's a call for all of us to also continue investing in research in all of these areas. So, and then, as I said, in addition to including in a mental health framework, we can also see substance use prevention or in a more adolescent health framework. And there is a global accelerated action for health of adolescents, kind of which make some recommendations backed by numerous UN agencies, including WHO. Some of this, I'm just putting it out here, sounds with what I presented before. So also this adolescent health kind of guidance speaks about substance use and makes recommendations of what works at the structural, at the organizational, and at the individual level. And here you see clearly that some of the recommendations are very specific or better to be applied around alcohol, and maybe for less so for drug use prevention. So for prevention, and then obviously the dream is really to come up and develop, take the evidence,
Anja?
Implement. Yes, time.
We have 2 minutes to go. Yeah, thank you.
Right, great. So around national drug prevention systems. So with that, I will be very fast then on anything around treatment for children and adolescents, where, I mean, based on the data from member states that we have, less than half of countries have reported to us that they have any specialized services for children and adolescents, and the barriers are likely very similar to those that we see for mental health care around poor access, lack of inclusive services, stigma, discrimination playing a big role here. So you have the international standards for the treatment of drug use disorders and this public health framework that they provide for the provision of substance use services, and also some guidance included there on, here you see it as part of the principles responding to special treatment and care needs of certain population groups, such as children and adolescents, and there is a specific chapter there especially for children. Maybe also just to say that in terms of this treatment and care framework, screening and brief interventions are very important. The WHO Assist is a very widely used screening tool. It has not been designed so much for under 18-year-olds, but it has shown that it's very possible to adapt it. And there are, not WHO backed necessarily, but there is an assist use version also available to help with screening in non-specialized settings. And this kind of is not from WHO, but there have been evidence reviews around what works for adolescent substance use disorder treatment, including family therapy, cognitive behavioral therapy, or multi-component therapies as having, you know, maybe the most well-established interventions. Our colleagues from SAMHSA have done a similar mapping and recommended a number of behavioral approaches to therapy for adolescents. as well as gone into kind of the details of the different family therapy interventions that are available. And similar like prevention, also for treatment, in the end, what we're hoping is to come up kind of with an overall national system where at the bottom you see how the needs of populations with special needs or clinical needs, which would include children and adolescents and their families, kind of would need to be addressed. So in closing, let me just highlight 2 or 3 things to bring to your attention. So the WHO EMRO region, so that's kind of North Africa, over to the Gulf countries and all the way to Pakistan, Afghanistan covered, has kind of a flagship initiative around accelerating public health action on substance use. So that means that there is a priority given to these areas, and I think that therefore kind of would be a good area or a good region, given there is this political interest already, to continue supporting prevention and treatment, including for adolescents. Also wanted to highlight to you that in the WHO Academy, there are new courses coming up which are available to all of you, including, for example, around behavioral counseling on risk factors for non-communicable diseases, which includes kind of substance use, especially alcohol. So there are learning opportunities free of charge. Also, just to highlight that at the end of June, we will host again our forum on alcohol, drugs, and addictive behavior. So that's registration only, but watch out for the news. And with that, thank you so much. And our contact details are here on the website, as I might not be available kind of at the end of the webinar, but please do not hesitate to reach out to us. And thank you so very much. And back to you, Gisela, and I hope I can take the slides down now. It looks like I can't.
Thank you very much, Anja, for this
Great.
comprehensive and enlightening overview that sets the tone perfectly for today's discussion. Your presence here today is deeply appreciated and highlights the attention being placed on prevention across different settings like work settings and on mental health, which I'm confident that we will recover with the other interventions today. And it also underscores the importance of collaboration with civil society and the value of multilateral approaches when addressing global challenge. So thank you very much, Anja. Thank you for your presentation. Now we move to Spain to hear about community-level engagement and international advocacy. Our next speaker is Mr. Oriol Esculias, a psychologist with nearly 3 decades of experience in supporting people with substance use dependence. Oriol serves as the International Commissioner of Proyecto Hombre, representing the network at the UN, European Union, and other forums. He is also Vice Chair of the European Union Civil Society Forum on Drugs and the coordinator of the Global Prevention Initiative, the Declaration of Oviedo. Oriol, welcome, and the floor is yours.
Well, thank you very much, Gisela. You might probably catch that we have both the same slang because we both come from Barcelona. I liked Anja's presentation very much. Thank you, Anja. Thank you not only Dianova International, but the Geneva Global Health Hub for bringing this matter in your activities towards the World Health Organization. And I think organizing this timely webinar with such a great panel is a good example. The impact of drugs on society, again, including alcohol, tobacco, and other legal drugs, has been and continues to be huge. Drugs are not only a security crime or economic issue, but a health issue affecting the health of millions and millions of people, including children and adolescents in all dimensions of health, physical, emotional, intellectual, social. Today, we focus on drug use prevention. What is the prevention paradox? What do you think is the prevention paradox? It is urgent to invest in health now when our children are healthy. They do not even ask for our help, nor their parents most of the time, because otherwise the problem of drug use in the future and the cost of it will be greater for them, but for society as a whole. This is the great or challenging prevention paradox. And this approach is usually a big challenge for governments and policymakers because it implies governing in a long-term view. The Oviedo Initiative is not only a declaration of 10 guiding proposals aligned with international standards on drug use prevention that you can find in 50 languages at oviedodeclaration.org. I'll try to put it in the chat box, the link, but a global mobilization started last year calling for evidence-based prevention to be definitely incorporated in drug policy. It's a very collective and inclusive campaign with more than 3,000 institutions endorsing already and counting with observers such as UNODC, which we very much appreciate. Probably the main strength of this action, bridging the local with the global, lays on the voluntary work of 174 country focal points. And I feel so happy to share this panel with 3 of them, amazing professionals and organizations: Gisela for Switzerland and coordinating this webinar, Shuruk for Yemen, and Christina for Pakistan. We also have Cressida as member of the global task force of this initiative. Moreover, having WHO, UNODC, and other colleagues on board today certainly makes me feel slightly optimistic, since they are very instrumental. I conclude by noting that the resolution on prevention recently adopted at the UN Commission on Narcotic Drugs last March in Vienna hopefully will become the necessary turning point for member states to scale up effective prevention at the forefront of drug policies. So thank you so much, Gisela, and everyone.
Thank you, Uriel, very much for illustrating how prevention can be strengthened through multi-level collaboration and local engagement to take the leadership on this global declaration. So let's now hear from Yemen, where dedicated efforts continue even amid very complex challenges. Let me now introduce Shuruk Mansour Ali, a public health expert and a focal point for Yemen in the Global Initiative on Drug Use Prevention that already Uriel explained. She currently works as a grant officer at the Psychiatric Care Developmental Foundation, providing MHPSS services to vulnerable groups in Yemen. Welcome, Shuruk, and yours is the floor.
Thank you so much. This is Shuruk Mansour. I'm the focal point of Declaration of Ovidio in Yemen. After 10 years of conflict, Yemen remains one of the world's worst humanitarian crises, marked by ongoing violence, climate change, economic collapse, and the breakdown of public institutions and services. According to the 2024 Humanitarian Needs Overview, over half of the population, an estimated 18.2 million people, require humanitarian assistance. And research has shown that population affected by armed conflict, especially displaced individuals, they are at higher risk of drug use as coping mechanism for emotional and psychological distress. And in Yemen, factors such as prolonged psychological trauma, disrupted education, widespread unemployment, and chronic poverty further elevate this risk. And despite these realities, mental health and drug use remain deeply neglected areas in Yemen. So addressing like drug use in humanitarian settings is a priority. Now, me as the focal point of Declaration of Ovidio, we really face significant challenges in advancing this important initiative, particularly with engaging it with the government structures. One major obstacle is the country's political division. The administration is actually split between the internationally recognized government in the south and the de facto authorities in the north. So any coordination activities must occur with separate entities. And also the sensitivity of the topic itself really complicate the efforts made. However, we do believe in the urgency and also the value of the declaration, as Yemen lacks reliable data on drug use. And one of the declaration core proposals is emphasizing on the evidence-based strategies like data collection, monitoring and evaluation, So if we have the data, then we can go and guide national policies and prevention programs. So in Yemen, we cannot really like deny or ignore the existence of the problem, even if it continues to be overlooked here in Yemen. Thank you.
Thank you, Shruk. Thank you very much. Can you hear me well? My microphone, I'm not sure. Okay,
Yes.
thank you.
Yes.
Thank you, Shruk, for highlighting the realities of frontline work in fragile settings. Thank you very much for joining us today. From Yemen now, we turn to Pakistan for a deeply personal and inspiring experience. Let me now introduce our next speaker. She's Christina Bon Sperling Afridi, founder of the Karim Khan Afridi Welfare Foundation in Pakistan. After tragically losing her only son in a drug-related incident, she launched Karim Khan Afridi Welfare Foundation in 2015 to empower youth through awareness, life skills, and education using 5 pillars: drug awareness, sports, environment, arts, culture, and civic sense. Thank you very much for joining us today, Christina, and yours is the floor. I think you are muted now.
Hello, everyone. Thank you so much. Nice to see you all there. Well, I'm going to read so I can be on the 2 minutes that you had mentioned about. And I must say, Oriol was very good. So currently in Pakistan and across the region, drug use prevention strategies are significantly underrepresented in public policies agenda. So the Oviedo Declaration, launched in 2024, presents a powerful and timely call to action, urging nations to prioritize prevention in their drug policy. For Pakistan, this framework offers a critical opportunity to redirect focus towards long-term sustainable solutions. So to understand the urgency, Pakistan lies at the heart of the Golden Crescent. I'm sure every one of you have heard about Iran, Afghanistan, and Pakistan, one of the world's most notorious drug-producing regions. So among South Asia's nations, Pakistan is the worst affected by the drug menace. It harbors the largest heroin consuming population in the region, a crisis now compounded by the rise of crystal meth ice. No? So on demographic risk, with a population of 200, just for a clarification, a population of 250 million, Pakistan has a staggering 154 million individuals under the age of 30. So 48% of whom approximately 74 million are girls. So you can imagine that this massive youth population represents the country's greatest potential, and it is the greatest vulnerability. So the growing threat of drug addiction among youth people poses immense social, health, and economic challenge for the nation. So KKWF has been a leading voice in advocating for drug use prevention in Pakistan. The foundation is actively raising awareness among policymakers, civil society, and other stakeholders about the Oviedo Declaration and its significance. Our goal is to ensure that prevention becomes a central pillar of nation drug policies, backed by the resource, coordination, and commitment it urgently requires. So one of our core focus areas is strengthening collaboration between governments, civil society organizations, and the business sector. Unified and strategic approach is essential to effectively tackle this public health crisis. Equally important is the integration of drug education into the school curriculum, from middle school through higher education. We champion an evidence-based, stigma-free approach that fosters emotional intelligence, social resilience, and critical thinking. We believe that prevention must become not just a program, but a way of life, Only by nurture a culture of prevention can we protect future generations. So as we're celebrating our 10th anniversary, I would like to just mention that Oriol already, as we met in Turkey, I had introduced to him. So KKWF celebrate a decade of commitment. We remain guided by one principle: meet young people wherever they are. So today, youth turn to their phone, not institutions, for answer. But what they often find online is confusing, unreliable, or dangerous. So we built something that called Clear Minds. So it's an app, digital app using AI to guide, not track. So Clear Minds technology will purpose, I think what Wadih will be interested as well. It's designed for youth. Here, what is it delivers? Real expert content, blogs, videos, and campaign about drug prevention and mental health. An AI chatbot that personalized support and speaks like a friend. Hamsat Hair, which is based on Unplugged, this European program, UNODC, that we practice here for the past 5 years, a culturally adapted version of this UNODC Unplugged program. So trainers and social workers also will be able to use this tool, and smart survey using feedback to constantly improve the platform. So current is in testing, but I think that our goal is to scale globally with international partners using technology for good. So back into the Oviedo Declaration to conclude, with its growing global endorsement, amazing, Oriol just said 3,000 now, inspires and guides us in our mission. KKWF remain committed to advocate for its implementation and to mobilizing all sectors of society to prioritize prevention in both policy and practices. So Pakistan now stands at a critical junction with the largest youth population in its history and a rapidly changing drug landscape. Prevention, it's not a choice, it's a necessity. Mm-hmm. So we hope that with the collaboration of all of us, nationally and internationally, the people that believe that prevention is the key for this. So we're looking forward to collaborate, and thank you so much.
Thank you. Thank you very much, Christina. Thank you for your powerful testimony and the transformational work you do in Pakistan. And I also keep for myself the phrase, using technology for good purposes. I am pretty sure that that would be a really nice theme for another webinar. How can we use AI and all the technology for good purposes as well? Thank you very much. So we now move to India for a perspective shaped by 4 decades of experiences in the field. Let me now introduce Dr. Rajesh Kumar. He is the Executive Director of SPIM, an NGO with over 40 years of work in drug demand reduction in India. SPIM holds consultative status with ECOSOC, and Dr. Kumar serves on multiple governmental and international bodies. SPIM has received 3 national awards for its work with marginalized community. So thank you very much, Dr. Rajesh Kumar, for being with us today, and yours is the floor.
Thank you, Jessila. Thank you for the opportunity, and thanks to Dianova. See, as you said, that we have been working in for almost 4 decades. And in last 15 years, what we have realized that suddenly the drug use among children has grown, like many fold. And as you are aware, India is a sandwich between Golden Crescent and Golden Triangle. So we have been getting a lot of drugs. And in 2010, we started working with the children, those who have been working, those who were dependent on drug. So next slide. I'll give you some data so you will understand the issue what we are facing right now. Next slide. Yeah. So if you see, that opiate use is almost 4 million children in India. Please understand, India has a population of 140 plus billion. And as Christina said about the Pakistan, the same data is valid for India. A large young population below 18, and some of them are experimenting, some of them are initiating to experiment. So the 4 million opiate user is a very big number. Similarly, we have inhalants. Inhalants is mostly with the children, those who are on the street or around railway stations or around bus stand. Then we have a cannabis use, which is around 2 million. So so this is the data which is very important to understand that this is a huge problem, and we are not in a position to address all the treatment related to the target. Next slide, please. Next. So what we have been doing, because our role is more as we have 4 or 5 role right now in India. One, we have developed models for the country, and through these models we do the engagement of various state level government and government of India, and we tell them that this is a problem which needs your urgent attention, and also funding. Without funding it is not possible. So the estimates are that 99.9% kids are not using drug. So if they're not using drug, and what has been said by previous speaker, or that if they're not using it, they must not use it, and that is a real prevention. So for that, what we have done, we have developed a module is called Navchetna. I'll come to this little later. The Navchetna is a very unique program. This is a school-based teacher-led program. When I say school-based teacher-led program, then it is the responsibility of the school to ensure that substance use and mental health are integral part of their ongoing activities. And we engage with education department of particular state where we go, and this is all under the direction of Government of India, like Government of India and Ministry of Social Justice, which is the nodal ministry for drug demand reduction, and Ministry of Education, which is a ministry for education. So both of them have come together and they have signed MOU. And then what happens, Ministry of Education has directed to their training wing. We have around 38 states and union territory in the country. So all of them are supposed to implement. So they select the master trainer. SPYM, our organization, we train those master trainers, and then we do the backstopping. So then once master trainer is trained, they are supposed to train at least 100 teachers over a period of 12 months. And then all those teachers are supposed to train further their colleague in various schools from where they come. So this way, we want to reach out to at least 1 million teachers in next 2 years' time. The progress is not so encouraging, because by now we have trained only around 100,000 teachers, and still 900,000 teachers are to be trained, and we are supposed to reach around 50 million young kids, those who are vulnerable. So this is called school-based teacher-led program, and for which videos have been developed. Game and activity-based modules have been developed, and which is available on SPY website also, and it is available on Government of India website. One can use it, and currently these videos are in English and Hindi, and we are thinking to develop another 12 regional languages. India has around 25 languages, and these languages are full-fledged languages. Like in Europe, you have so many language, but then the European Union is one. The same way it is like India. So that is one program we have developed over a period of time. Second program, we call it a community-based peer-led intervention. Now, this peer-led intervention, this is specifically for the area where drug use among the adults are high. So the kids, those who have started experimenting it, those who have started using it, for them, this is a peer-led program, and we have tested it. And this program has also been taken by Government of India, and it is being implemented in around 300 plus districts of the country. Those districts which has a high seizures of drug, especially the border districts of bordering Pakistan, bordering Myanmar. So these are the states where peer-led intervention is being implemented. Next slide, please. Next. So, and the best part is, please go back. Yeah. So, it's very rare that an NGO who has developed a module which was launched by 5 chief ministers and governors of northwestern part of India, and it was released by 2 cabinet minister of India. One is Mr. Amit Shah. He is the number 2 minister in the country after Prime Minister, and other was the social justice minister. So it means that at the highest possible level we could reach out to them and we could convince them that this is something which needs to be carried out, and they have allocated a huge amount to implement this in all the schools of the country. Next, please. I will not go in details, but these are the sessions generally we organize, and then we also what we do. Every training has inbuilt MIS, and in that MIS, what we do, we ensure that wherever we receive some feedback, we further improve it, and we have developed an app. Now this app has a unique feature that if a teacher presses a help button, so that through the AI chat box, we will come to know which teacher has requested support. Then we SPY cannot reach out to the whole country, so we have our around 600 partners and government hospitals. So we request our government hospital, without disclosing, contact the teacher, or we inform teacher that you reach out to this individual and this is the phone number. So, and then we also do the follow up to ensure that the child is provided support. Now, at this stage, we also request teacher not to announce in a school, not to inform anyone, including parents, because there might be some just initiation, or some child might have asked something which might go beyond which might create problem for this individual child. So our program could be hampered. So these are the precautions we have done over a period of time. Next slide, please.
We have 1 minute left, Rajesh.
Oh, I'm so sorry that you have to move
It's okay.
faster. Sorry. So these are the. Please go ahead. Next. This is that peer-led intervention, and this entire program is a community-based, where we have a third tier of elected representative. We called it a Panchayati Raj. So they organize this program, and this is based again in the community. It's the peers are provided training, and peers are paid by the government program. Next. I'm so sorry. I did not realize. Next. So we have developed 3 treatment centers in the country, and 2 years back we had almost 100 delegates from all over the country. They came and visited. Of course, Dianova's representative was also there. One treatment program is for the children, those who are in conflict with law. So they are sent to us through the court, and this was one of the first program or alternate to incarceration in our part of the world. And the child is sent to us through the formal court order. Then the child stays with us for 3 months. We do the detox, rehabilitation, reintegration back in the family and society. So all those issues are handled at this particular center. The next center is the children, those who are not in conflict with law, but they have substance use issues. They come to us through the child welfare committee, and they also stay with us for 3 months. And the third center we have, it is called, it's for the girls, those who are below 18. Good number of children, those who come to us, are also HIV positive or hepatitis C, Hep C positive, or TB. So we ensure that all of them are treated in the formal government hospital, and they are provided, if someone is HIV positive, till lifelong, all the requested say ART is provided. For Hep C, we ensure that the hepatitis C treatment is provided. But this all comes through the government system. We are only the link. Next. So these are some photographs. Next. This is this. We work very closely with police and criminal justice system and judiciary, and because of their help, we could achieve much more. Next. Okay, next. So these are the therapies we do at our center. Please remember, we are practitioner also. So whatever we develop, say for example, mindfulness over in last 2 years time we have developed, and it is doing very well. Today, incidentally, today is the Buddha Purnima. In most of the Asian countries, the Buddha got enlightenment today. It's a full moon day. So mindfulness is the teaching of Lord Buddha, and this is very, very good for the kids, those who are in recovery. Next. Next. Thank you. I'm so sorry. I did not realize that how much time I had.
It's okay, don't worry. Thank you very much. Rajesh is amazing, and thank you for underlining the value of community-based right-driven prevention strategies and how well the very difficult situation that so many children are facing right now, being HIV positive, using drugs as a coping mechanism, and how can we, do fair and quality treatment for those children. Thank you very much for that.
We have treated more than 10,000 children by now.
That's a huge figure. Thank you for sharing this information. I wonder if maybe you can share all the information that you put in your PowerPoint through the chat link for the attendees. Thank you very much. So now let me introduce our next speaker, Ms. Cressida DeWitt. She serves as, we are now traveling to Sweden. I didn't say that, but Ms. Cressida DeWitt serves as a project coordinator and communication manager at the World Federation Against Drugs. She leads projects in the DRC, Kenya, India, and Georgia, and is involved in the World Federation Against Drugs Gender Committee and Youth Network. She co-authors position papers and studies advancing youth a gender-responsive policy. Thank you very much, Cressida, for being with us today, and yours is the floor.
Sorry, I forgot to mute myself before sharing the screen. Thank you so much for having me here and for being part of this distinguished and very inspiring panel, to be honest. I've learned a lot over the course of the last hour and hope to contribute a little bit to that. And thank you to G2H2 and Dianova for hosting it as well and focusing on prevention today. So we as WFAD, we strongly believe in it and advocate for prevention as a whole, but also very much on the importance of early prevention within the overall framework of the continuum of care. As I would like to say, it's a kind of a chain that would not be complete without it. So as professionals in the field, you most likely have seen the chart that is shown here on the screen. The chart of the continuum of care, ranging from prevention, treatment, recovery, and aftercare. And while many prevention programs are generally focused on school-age children, teenagers, and young adults, due to the high risk for experiments of substances, research clearly shows that prevention efforts must start even earlier. Because the early years of a child's life are a critical window for brain development, and this is when the foundation for decision-making, impulse control, and resilience is laid. And when young children learn how to manage these emotions, resolve conflicts, and set goals, they're developing the core skills that support healthy choices in adolescence and adulthood. But prevention is not just about the child. The child cannot do it all by itself. It's also about the environment that surrounds them. And this means that we need to consider both micro and macro level influences, as shown is on the screen, such as family dynamics and broader community support. That is why early prevention begins as early as pregnancy, aiming to create safe, supportive, and nurturing environments from the very, very start. So how do we as WFAD support early prevention? So for those that do not know us yet, we are a global umbrella organization with over 470 organizational and 1,000 individual members ranging in 73 countries. And our joint aim includes to strengthen prevention, increase access to treatment, and promote recovery. And we place particular emphasis on the rights and needs of women and children. As Gisela already said, we do have the Global Gender Committee since 2020 as part of our 10-year strategic plan, and launched a youth network in the following years. And so what do we do as work to fulfill our aims and support our members? We undertake various activities, which can be divided into three pillars. So first of all is the capacity strengthening training, which is complete with webinar series, capacity strengthening trainings, regional forums, and world forums. And in our capacity strengthening trainings, we aim to fill the gaps shared by our members. And oftentimes this actually is including prevention and early prevention as well. We also have advocacy as a pillar. Together with our members, we work at national, regional, and international levels to strengthen prevention and expand access to treatment and promote recovery. And thanks to our ECOSOC status, we are able to represent our members and aims at various international institutions such as the United Nations, the African Union, and the European Union. And one of the recent advocacy efforts, which you will see on the slide as well, was the Global Youth Declaration on Prevention, Treatment and Recovery, not to be confused with the earlier amazing declaration, Oviedo Declaration. So this Global Youth Declaration was launched during the 68th Commission on Narcotic Drugs in Vienna this year, and it was developed based on the insights of the Global Youth Survey, which gathered responses from 1,145 young people across 63 countries. And the goal was to engage youth in shaping the conversation around substance use and ensuring their voices guide the work of policymakers, civil society organizations, and service providers through their recommendations. While we also contribute to many of the other youth declarations that have, of course, already been presented by various organizations. And the Youth Declaration also, since it was based on the survey, we also wanted to have the opportunity or create the opportunity to understand the currently faced challenges and needs, which was published in a separate research report. So the recommendations based on this research report and the survey include 6. So first one is actively listen and involve youth, enhance research and modernize awareness campaigns, implement gender-responsive approaches to substance use challenges, ensure increased provision of improved and accessible youth-sensitized services, empower youth through economic independence and leadership opportunities, and strengthen community support and policy enforcement. All of the 6 are also more in depth, explained in depth, and to be found on our website, of course. So as this initiative is maybe not a direct example of early intervention, understanding the current challenges, including environmental challenges, and by promoting youth engagement, we are in a better position to develop more effective programs, including early prevention programs. I would also like to dive briefly into our last pillar, which is the implementation of international development projects carried out in close partnership with our local members with a rights-based approach. And our project ranges from raising awareness around prevention and recovery to delivering support services for treatment and reintegration. And one project I would like to highlight specifically is the Sober Youth Healthy Communities, Transforming Violent Youth, which was implemented in Kinshasa in the DRC from 2020 to 2024, together with 3 local partners. And the goal was to help young people exit and prevent others from entering the violent street gangs known as the Colunas, through social support, vocational training, income generating opportunities, and reintegration activities. The project aimed to empower youth and support this transition into stable and healthy lives. And by the end of the project, we have supported over 1,179 young persons. We also established 12 business and operation units in areas such as tailoring, hairdressing, plastic transformation, agriculture, and borehole management. And these became platforms where young participants could apply their new skills and gain financial independence. So I want to emphasize this project not only for its reintegration success, but also for its contribution to early prevention. Because when I visited Kinshasa last year, I had the chance to meet young women who had once been part of the Colunas and now had since reintegrated, had become mothers themselves, and were working in a tailoring cooperatives. Some had took their young children with them to work, and they spoke about the changes in their lives. And to me, this experience illustrated the full continuum of care from recovery to aftercare, and now creating a safer, more nurturing environment for the next generation. So these women not only overcame substance use and crime, but are now also active agents of early prevention for their own children. So with that, I would like to conclude my presentation. If you have any questions, feel free to reach out or visit our website. So thank you again, Gisela.
Thank you very much, Cressida, for spotlighting the importance of early prevention and amplifying youth voices, and also to translate political will or health or drug policies will into really grassroots activities. And so nice experience. Thank you very much for that. And I would like to remember everyone too that we would love to hear from you as well. If you have any questions or reflection during the session, please feel free to share them in the Q&A box. We have an amazing lineup of speakers today, so take the chance to ask them. So next we go to Canada. Let me introduce Dr. Rebecca Heinza. She's a public health sociologist and associate professor at the University of Calgary. For over 20 years, he has worked with youth and feminist and substance use research. And today she will explore how traditional prevention models often fail and why meaningful engagement and upstream harm reduction approaches are urgently needed. Welcome, Rebecca. Thank you very much. And thank you for joining us in such an early time in Canada.
Good morning. Thank you for having me. I'm going to talk today about why we need to radically rethink drug prevention based on the evidence and policy innovation we've seen in Canada. I first want to start by just introducing you to me. And if you do search me up, you'll see that for many years I was part of a very well-known television program for teenagers in Canada where my character used substances. And that is my introduction to youth substance use and how I launched my career in supporting and helping youth through that early experience as a teen actor. And also I'm the parent of two teenagers, the gorgeous sons you see here, Quincy and Trey, and they really orient me to everyday challenges in walking the talk of what I know scientifically. And I just want to acknowledge that that's where I am. So we do need to radically rethink what we've done in prevention, and I'm so honored to close out the speakers and to see what my colleagues have been doing that embody many of these principles of youth engagement, of getting upstream, and of community-led intervention. But unfortunately, what we know from North America specifically and other jurisdictions, prevention has been based in values, not in evidence of what works. You may be familiar with campaigns of the past, such as initiated during the Reagan era of the war on drugs, Just Say No, which was never based in any evaluative science. It was just a slogan that the First Lady brought out. Police-based approaches such as DARE, very popular in North America, but the evaluation evidence unfortunately shows it's absolutely associated with some increases in substance use, mainly because we hypothesize marginalized youth do not respond well to seeing police authority figures in the classroom when they've perpetrated violence in their communities. This is a special concern for me and my community as a parent of Black children. I also have the SHOT campaign from Doigts de non-fumé in France, right below here. And this was, equating substance use to sexual violence. Adults have initiated very harmful campaigns stereotyping and stigmatizing youth. So what we have coalesced around in Canada is something that we put forward in the Chief Public Health Officer's 2018 report on preventing problematic substance use in Canada. And that is the best prevention has very little to do with drugs. If we want to improve outcomes for youth, focusing less on educating on specific substances, but getting upstream to promote community well-being and individual, family, community resilience is really where we need to invest. If we want to look at the high-level review evidence, we know that didactic, information dump, focusing on specific substances has been ineffective. What is effective is focusing on interventions that are psychosocial and developmental, that foster conflict resolution, problem solving, social emotional learning, all those things that equip youth to navigate difficult experiences that they may encounter with peers, with trauma, with community-led conflict. Those show over the long term some positive outcomes. Other things that we do, we invest a lot of money in terms of education, unfortunately, don't always equate to better outcomes. Very hard to implement and evaluate system-wide, and very hard to generate that data. So it doesn't mean that we're not making these good efforts, and we're often compelled to do these programs, but the evaluation evidence is often lacking. We do have also good evidence of community level intervention, and I want to point to Iceland's Planet Youth, which is being implemented in Canada and some areas as well. And of course, Iceland didn't get into the classroom and educate youth on drugs. They implemented free recreation, free arts-based programming, and over time, they saw a dramatic drop in youth tobacco and alcohol use in this context. So that is one high-level example of community-led intervention that's been rigorously evaluated. So in this context, we've put forward that prevention pyramid, intervening early and often for those youth that need support. But what I want to focus on from my public health perspective is at the bottom. The more we strive to create equitable social and economic conditions and address those injustices, the better the outcomes. Of course, this is more challenging to tackle than through a discrete youth-based program, but ultimately that's where we need to align our vision. I want to also just share what's happening in Canada and share that our current situation really demands, in addition to prevention, harm reduction approaches for youth to prevent drug poisoning death. We are in the midst of a public health emergency in drug poisonings in Canada. We have had over 50,000 people lose their lives since we started monitoring our current opioid and stimulant crisis in adulterated substances since 2016. In my jurisdiction, Alberta, a very small state of only 3 million people, we saw 60 deaths of young people 10 to 18 last year. Drug poisoning is now the leading cause of death in the western part of Canada for those 10 to 18, above cancer, above car accidents. And in America, it's the third leading cause of death. It's equivalent to about a classroom of students a week. We hear a lot about school-based violence in America and gun deaths. We are losing a similar amount of young people to drug poisoning. So in this context, we need to look beyond abstinence for youth who may be at risk, who are maybe experiencing in a very volatile context where unregulated drugs using just once can lead to poisoning death. We need honest science-based information. We need to encourage moderation if experimentation exists and persists. And for youth who are using substances, we do need those very focused harm reduction interventions. We need availability of naloxone. We need access to supervised and safer consumption. We need access to safer supply of substances and OAT prescription for young people who are often left out of the equation, and pediatric and youth health providers are not often equipped to have these conversations about the risk of death and what we need to do to keep young people safer. So I'll end it there. Thank you very much for having me and for this invitation.
Thank you, Rebecca, for challenging us to shift how we think and talk about prevention. That's super interesting. Thank you very much. And maybe we can share afterwards some papers and resources as well. So thank you for that. Well, now we move to our closing remark from UNODC Global Coordinator for Drug Prevention. We are especially honored to close today's discussion with Dr. Wadih Maalouf, Global Coordinator of the Drug Prevention Program at UNODC. With over 25 years of experience and a PhD from Johns Hopkins, Dr. Maalouf is a driving force behind global prevention responses like the CHAMPS initiative. We thank you profoundly, Dr. Maalouf, for your continued work and leadership, for being with us today and for supporting the global community in building effective human-centered prevention system. Thank you very much, and the floor is yours.
Thank you very much, Gisela, and let me first really thank the organizers, the G2H2, for opening this forum for civil society organization for this conversation, and also thanking Dianova for picking specifically this topic within the conversations that are ongoing and inviting us to join. I'm following up on what my colleague from WHO, Anja, has mentioned in the beginning. She covered a lot. I will be brief. So this specific discussion comes at a very timely time, really, in terms of our programming, generally speaking, both as international organizations, as engaged with member states, and at the time when civil society also is calling for such actions. Why is it a special time? It's because the presence of science, a science that we have been calling for, is available now. There's a lot of standards that are being put in place, both at the prevention and the treatment side. The standards that we have jointly called in as WHO together with UNODC. So we have summarized these policy for policymakers. But more importantly, there's a more stronger sense of recognition of the science, both by the grassroots organizations, by the civil society. One of them, if I'm not going to pinpoint, but there has been several calls. You've heard of civil society organization talking, but let alone the Oviedo Declaration, more than 3,000 civil society organizations from all over the world rallying around a common agenda, calling for this science and investment in this science. And on our side, recognition of the science for as UN by the governments. We have felt it here in the Commission on Narcotic Drugs in sort of a commitment to this science as articulated in the resolutions that they're making. Most recently, just March 2025, calling for a resolution for a change. After 2022, calling for early prevention. That for us was the first indication that early prevention, not in the course of prevention of use of drugs, but in terms of ages of development, investing more in the early ages from the child when is born till the age the child is 10, a completely different perspective of how prevention is, broadening their spectrum beyond just awareness raising and focusing on prevention in the real sense of building milestones of development, up to 2025 now when they're calling in for a multi-sectoral approach of prevention, despite all the challenges of the multilateralism that exists politically, both in the field of drugs issues and in the field of politics in general. There is a common sort of sense of really focusing first on science, second on early prevention, which is children and adolescents, and third, not working unisectorally, but working as multiple sectors. So these are really important milestones in terms of moving forward. You've heard it also in terms of active work on the ground. These are ingredients. It's an ingredient now that really opens up the way to make that knowledge, put that knowledge into action. Because now putting that knowledge in action with all of this, the science, the political commitment, the grassroots organization, now it is a right. Not a right time, but also a right that we have to make it happen on the ground. Prevention is a person-centered approach. And that's why a person-centered approach has to focus on the context that person is living in, on the vulnerability level. It's not like just generally the science, but it's important that that system that we're talking about leaves no one behind. And this system, in order for it to leave no one behind, should really focus not only like a one size fits all, but aside age, the vulnerability context, it's important to remember as well that gender is an important character within that developmental context, especially among children. When we're talking about boys and girls, their developmental path, their developmental trajectory are different. They're affected by the vulnerabilities in a different way. So that context of leaving no one behind should account for multiple things. And this is further reason why we should come in as a system. Another important element that I would like to mention during closing is something that has been mentioned repeatedly by other colleagues and panelists is youth. Youth need at this point in time not to be, at this generation of youth, they have excellent potential now more than ever. They should be meaningfully engaged in the prevention response, not only as mere recipients of the response, but they can politically advocate for the actions and they could be agents of prevention too. So all of this in terms of an approach supporting the notion of investment and investment in prevention is a call, especially among children, investing in the future generation and investing in development of specific countries and moving forward. Every child has the right to grow, and I really kind of commend you all for this call of action. That's all I can say. I will end by mentioning that the science is there. It's time to translate it into action. We need to prioritize and properly invest in prevention. Going back to the original title of this whole discussion, every child has the right to grow up safe, and we have all the means to make it happen. So we've seen the tools by WHO presented in the beginning. I call you in to see, like, also UNODC have all their tools at your disposal. Just a simple Google search in terms of UNODC prevention or UNODC treatment, and you will see all the tools at your disposal. Gisela, I would like to use the rest of the time to see any discussions that are happening in. I'll pass the floor back to you, and thank you again for this organization. Over back to you, Gisela.
Thank you. Thank you very much, Dr. Maalouf, for that compelling and solution-focused conclusion. Sadly, we are running out of time, so we will not have a long time for Q&A time. We had only one question addressing to Anja and Wadih Maalouf as well. Are there any plans to publish a third edition of the International Standards on Drug Use Prevention?
Yes. I mean, the thing is, it's the timing of when. We've done a preliminary review between 2018 and what happened afterward. There are some elements of new development, but not radical changes in terms of development of science. But hopefully by next year, we should have a revised version. And we really hope WHO will also join with us in terms of this revision as we did before. Maybe also using artificial intelligence to add to the search, but we're figuring out how to best do it. Working.
Okay. Thank you. Thank you very much for that answer. So, as I said, thank you for all our amazing speakers today. It's been great. So we have such a rich and packed agenda that unfortunately we are running out of time of more live questions, but we are happy to share all the resources and papers and the document that have been mentioned here today. And however, this session has been recorded, I will be available for further viewing and sharing. Let me say a few last words today on behalf of Dianova International and G2H2. Thank you to all our incredible speakers for today's rich and inspiring and very necessary discussion on prevention and evidence-based strategies. And I would say thank you for grounding us in the WHO global perspective and the role of public health in drug policy. Uriel for reminding us the power of values-based prevention rooted in real-world experience. Shuk for your courage work in Yemen and your voice from the field. Christina for turning personal loss into purpose and hope for youth. Rajesh for decades of leadership and commitment to the rights-based community-driving action in India. Cressida for highlighting prevention as a continuum and amplifying youth and gender perspective. Rebecca for challenging us to rethink outdated model and center new voices. And Dr. Wadih Maalouf for closing with clear call to multilateral collaboration, based action, and translating the knowledge to real and proper actions. So thank you very much for all of you. As we reflect on all these insights, one thing is clear: we must work together across sectors, disciplines, and countries, and to build health and drug policies grounded in science, public health, and above all, human and children's rights. Children and young people deserve nothing less. And I now pass the floor to Alessandra Tisi, who will share some of other exciting events taking place in the coming days. Stay tuned and stay engaged, because this conversation about evidence-based prevention strategies continues. So thank you, all of you. Thank you, Alessandra.
Thank you so much. I hope you can see my screen. I just really want to recall what Gisela said. I was not expecting this morning when I entered into this Zoom room to do a huge world tour. This was amazing, really, really beautiful. I would really wish we could have more time, because I would really know much more about what you're doing also on the fields, and really, really inspiring talks. Thank you really to all of you for being here today. And thank you so much to Gisela to actually organize and co-organizing the session. I really believe that this G2H2 weeks of policy debates could not have started any better. So my deepest gratitude to all of you. As Gisela said, the meeting has been registered, and the registration will be put into the G2H2 website as of tomorrow. And because you have shared so much information with us, if you want to share with me your PowerPoint presentations and also other documentations, I will be very happy also to put it on the website as well. And as I said, this is the first meeting of our weeks of meeting. I really hope to see you all on Wednesday at 3 o'clock. for another meeting that will tackle addictions in another way. In this meeting, we will discuss about tobacco addiction, ultra-processed foods, and always focusing on children. You can find all the information regarding this meeting and also the next one on Friday on the Pandemic Accord, which is actually one of probably most contended agenda items on the World Health Assembly that will start next week. You will find information about these two meetings and also information on the registration on the G2H2 website. And I really thank you again for being with us today. And thank you for such an amazing panel. Thank you so much.
Thank you very much, and good morning, everyone. Good afternoon.
Bye. Thank you.